Dr. Wayne Wheeler has a problem with the state of Ohio, and the state of Ohio has a problem with him. He's the medical director of Life Ambulance in Portsmouth and has one of the biggest ambulance companies in the state. He's also near the top of the list for wrongful billing. His company owes the state more than $400,000 in overcharges.
Did we make some mistakes in our billing? Absolutely we did. Did we do it knowingly or intentionally? Absolutely not.
He also blames a Medicaid and a healthcare system that is constantly changing.
Because of the paperwork, because of the complexities of the circumstances, the auditor feels that we've billed for things improperly. But as I said earlier, we're doing 10,000 runs a month.
Dr. Wheeler has not been charged with any crime and is working with the auditor to settle on the amount he needs to pay. He also disagrees with the auditor's findings on many of the charges. In cases the state has investigated, this is how the overcharging can happen. On average, Medicaid is billed $25 plus mileage to transport a patient one way, but it can be billed $250 if the patient is on a stretcher. Now, you own the ambulance company. How would you transport them? In a wheelchair for $25 or on a stretcher for 10 times as much? Let's say a patient is being taken from a nursing home to a dialysis center. In order to be transported, they need to be in a wheelchair.
A lot of companies, they see the difference in prices. You take a wheelchair patient, $25 one way. You take a stretcher patient, even if they do walk and don't meet the qualifications, you're getting $200 or more. So there's a great big price change, and that's how companies are getting in trouble, is they're, instead of following the rules, they're seeing the dollar signs.
Add that up over the year, and the difference is astounding. The Ohio Attorney General's office sends investigators out to follow ambulance companies and document patients who are walking in and out of the vehicle. Yet their billing says they were so sick they needed to be on a stretcher. In 2.5 years, the state was able to recover $2.5 million in Medicaid abuse overcharges just from transportation companies. The auditor's office shows millions more in fraud, and those are just the ones that are caught.
I am surprised at how widespread it is, particularly with the ambulettes.
In the last 2 months, Ohio Attorney General Richard Cordray was able to get 2 convictions on people who ran ambulance companies. One of them ran a company out of this warehouse on East Livingston. The business is closed and the owner is expected to be sentenced this month. There have been 31 convictions in the last 2 years, all involving similar shenanigans.
What we find is in the Medicaid program, there are people out there who find ways to cheat on every aspect of the program. They will bill for services they never rendered, or they will bill for inflated services that weren't quite what they did.
There may be no more small business in Ohio with the potential for Medicaid fraud and abuse than the private ambulance industry. More than 425 companies in the state are driving 3,100 vehicles. There is a constant temptation to overcharge, and even though dozens of companies have been caught, there's no way to know how many have gotten away with it. It is also, according to the people who work in it, more competitive and cutthroat than you can possibly imagine. Investigations are often launched after one company complains about another one.
Everybody's trying to, undersell pretty much each other, trying to sneak in and get all the contracts that they can.
With us, there's 10 other companies that we're all vying for the same, pretty much, nursing homes, dialysis centers, anything.
Think of us as a medical taxi, pretty much.
A medical taxi that bills Medicaid and Medicare, and therefore your tax dollars. In Columbus, I'm Mike Bowersock, NBC4.